Well, I was born in Vietnam. Our family immigrated from Vietnam when I was 6 years old. We immigrated to San Antonio, Texas. I actually graduated from Marshall High School and was lucky enough to get some scholarships and graduated from Trinity University. I graduated from Trinity with a biology degree, and I worked as a chemist for a while, but medicine kind of drew me in just because I was able to use both my knowledge of science, and it afforded me the opportunity to interact with people, and that was what I was really missing from chemistry. It also allowed me to just really help people out, and that's what I really want to do. I went to medical school at St. Matthew's University, and then spent 3 years of family practice residency up in Traverse City, Michigan. And then after residency, I ended up moving back here to San Antonio, Texas, where my family was. Medicine is constantly changing, you know. That's why they call it private practice, because you're always practicing, and you have to be able to keep up with the changes. And the way I'm able to keep up is I read journals, family practice journals, New England Journal of Medicine, you know, various websites. Also, that's why you have to get board certified to make sure you're up on the most recent updates. The Board of Family Practice has a website that I log on to, and they give me specific cases that I have to go through, and I have to figure out what's going on. They give us various data, and I have to work through each situation to figure out what's going on. So it kind of helps doctors just stay updated on the most recent guidelines. Our office is family practices, so we do a little bit of everything. We go from children all the way up to geriatrics. So the age ranges from 2 years old to just whenever. You know, I have a patient who's 95 years old. She's kicking like she's 30 years old. It's awesome. My approach to diabetes, the main thing is education. My patients have to understand what it is before they know how to treat it. They have to understand it's all about, the main thing is about lifestyle changes, and if that doesn't work, then, you know, we can start medications. I had one patient who came in, his diabetes was just out of control. And I sent him to diabetes education. I started some medications, and wow, his blood sugars were under so much better control after we went through the education part. It was just amazing. There was a new patient that came in, and he was complaining of fatigue. So I performed just an examination, and I ordered some labs, and he was found to be severely anemic. So I sent him to the hospital because my big fear was that he was losing blood through the GI tract. The most common cause is colon cancer. And as it turns out, he had colon cancer, and he had to have an operation. They took out the cancer, and he was cured, essentially. He's seeing an oncologist right now, but he was so grateful for me, he thought that I saved his life. It was fantastic. It was a wonderful feeling. So when someone is going through just a really terrible illness, their psyche is always going to be affected. And it's very difficult. So I try to help them out as much as possible, hold hands, try to be there to support them as much as possible. But it's difficult, especially if someone has a terminal illness. And you just have to be there to support them, and through their tough times, and they're gonna feel depressed and whatnot. You just have to be there and just be kind of their shoulder to cry on, and I've shed some tears, you know, with some of my patients. It's not difficult, but it's part of the job. As a family practice physician, we pretty much do a little bit of everything, but there will be certain situations where we need to call in specialists, and our practice is fortunate enough to where we can just call in a specialist, because I've got a lot of their cell phone numbers. I can just call them up directly and say, can you please see my patient? And they're usually very receptive. The cost of medicine is just really skyrocketing. I think everybody knows that. And I'm really mindful of it with all my patients. So when they're coming in and I need to draw labs, I try to just draw only the labs that are necessary. And medication's very expensive. So again, I try to find the generic medications that'll work first, and to save on costs. And if the generic medications don't work and we need to go to a name brand, I will do that also. But again, cost is expensive, so I'm trying to save my patients as much money as possible. Being a physician is a lot more difficult than what people would think. The decisions you make throughout the day can really affect people's lives both negatively and positively. And so, yeah, we have a big responsibility, and sometimes it wears on us, but at least I try my best, and with the knowledge I've been given, and the decisions that I make, I think by the end of the day, and when by the time I go to bed, I feel good about the decisions that I make for my patients. And I think that they're going to be better off for what I've done for them. One of the unique things about our practice is that I work with my sister. You're not going to find too many practices where there's a brother-sister combo. And you figure, that there'll be a lot of conflict, but actually not. I grew up in a family of 7 kids, so I'm used to having a lot of people around, and my sister and I, we've always been pretty close. We tease each other a lot, and when I see her patients, I send little jabbing remarks to have her patient relay to my sister Wendy, so it's kind of fun that way. And the patients actually, they really enjoy it. They have a good time with this, so that's one of the unique dynamics of our group. Everybody gets along really well, and it's just a real laid-back atmosphere, and I think I had a good time, actually.